Well, if you've ever had a bad bout of heartburn, and who hasn't, you're one of the millions of Americans looking for relief from acid reflux. So here to give us some helpful tips on how to prevent it is the author of the new book, The Acid Reflux Solution, Dr. Jorge Rodriguez. Good morning.
Thank you. Glad to be here.
Thank you so much. I think right out of the gate, we have to get to what is the difference between heartburn and acid reflux, because I've always called it heartburn.
Yeah, it's six of one, half a dozen of the other. Heartburn is basically a symptom. You're describing something that you feel. So, you feel like the burning in the area of the heart. So I think it's just something that people use. Reflux is actually sort of the medical explanation of what's going on. And reflux, like the name implies, is when something comes up. And the stomach contents, when they come up above the stomach, that's when you feel heartburn.
Right. Now, is this mainly genetic, or is this, things that you're eating, going to be a combination of both?
Well, it's a combination of both. Because one of the things that causes heartburn is, and people don't like to say the word sphincter, but we have a sphincter right here. And some people in the family, like I have a hiatal hernia, so I'm predisposed to heartburn. So the genetics is that. And then sometimes what we learn from our families too, which is bad eating habits or habits, so they're both tied in there really closely.
What are the symptoms?
Well, the symptoms are, if you have burning, sometimes as the food goes down, that could be heartburn. If you have an acidy feeling after you eat, like an hour or so, that's probably heartburn. But some of the less common symptoms that people don't even think about could be heartburn: coughing, asthma, sore throat, chronic sinus infections. So if the acid goes way up, it can come up here. It can damage your vocal cords. I mean, singers know that. It can go into your sinuses. And so, around 30% of asthmas are due to reflux.
Does the time of day you eat play a role in whether you have acid reflux?
Yeah, absolutely. And I'm one of the worst ones for that. Eating late at night, and coming home, rushing, eating late at night, and then lying down, to watch TV with your best friends, Ben and Jerry. That's not good. It's a good party, but man, you pay for it.
I saw you on The View. I know that you're a good friend to Whoopi Goldberg, and this was something that she struggled with as well.
Yeah, well, I cannot talk about my patients, but but she talks about herself, and it is, and Whoopi's a picky eater, and she does have it. I have it, so we can commiserate about that.
I was telling you earlier before the show, when I was pregnant, I had it a lot. Is that
super
something
common.
that's common?
Yeah, it's super common. First of all, one of the main causes of heartburn is being overweight. And you don't have to be a rocket scientist. You have a lot of abdominal girth. It presses up on your stomach. So the baby did the same thing to you. But you were able to cure it a little bit.
They have been a pain in my side from the beginning.
And a pain in your stomach. So it slowed down the emptying of your stomach, which is the key to treat heartburn.
That would explain it.
Of course. And we all know that there's medicines out there, over-the-counter things. How do these, how are they different from one another?
Well, first of all, the medications are great. And I'm a gastroenterologist. This is what I do for a living. The problem with this is that since they're so easy to obtain, people overuse them. And, the stomach needs acid to help you absorb calcium and iron. If you overuse it, you're going to become anemic or get osteoporosis. But there are three types. All right, this one.
Lived on it.
It's tasty, and they know that you don't absorb calcium because now they come with calcium, right? So they know that you're not absorbing it. But what this does, it basically just buffers the acid.
Okay.
This is like buttermilk. 20 years ago, just say drink milk every 2 hours, you'll feel better. Zantac actually stops the acid in your stomach around 50%. All right, and then the big daddies of them all are these called proton pump inhibitors, like Prilosec, Nexium. Don't get me wrong, these medicines are great when used appropriately, but if you use them for a long period of time, over 3 or 4 months, you may have problems with anemia and eventually with osteoporosis. So the key is to be more holistic about it and not use these medications all the time. That's just not good.
So tell us, what should we do? And I know it's all in your book.
Yeah, well, the first thing you should do is buy the book.
Yeah.
All right, The Acid Reflux Solution. But in the diet, the key is to increase the fiber. And this is, we've talked about this. So everybody talks about this, all diets. When you have fiber in your diet, the stomach empties a lot more quickly. All right, the acid doesn't sit there. Smaller portions. All right, use natural oils. For example, we have a salad there that has avocado and arugula. All right, there are recipes in here with hamburgers, meatballs, and spaghetti. But the beef is usually like grass-fed beef, that people say, well, that costs a little more. But it's super high in omega-3 fatty acids. And by the way, what's the cost of this?
I was going to say, that's one of the more expensive drugs,
yeah,
isn't it?
So you know what? Spend the money on quality food for you and your family, and you'll be healthier,
right,
in the long run. And then there's some things that are really great for you. Fennel, ginger. You look at a lot of old cultures, say the Greek culture, Italians, after dinner, they always have certain aperitifs, little wines, like ouzo. It's usually licorice, which is fennel. Right? And Asian cultures, everything is ginger. That helps the stomach empty a lot quicker.
Wow.
So go ahead, Ray.
What about acidic foods? Things like tomatoes, things like wine. Is that myth or is that fact?
Well, great question. In that view thing, Barbara Walters kept on asking about tomatoes. Did you see that?
Yeah.
And I go, is that like a tomato?
Yeah.
If you have burning in the esophagus, if you actually have esophagitis, for a month, you should not have acidy food. Because as it goes down, it burns. But once you heal, it's a myth. You can have acidy food because the acid in the stomach is so much more acidic than anything you could eat. As long as it gets out of your stomach quickly, there's not a problem with it.
All right. Well, we have G, who monitors our social media in the audience. And, of course, folks at home have some questions for you, G.
Yes, here's a question from Vicki Townsend. She wants to know, how can you tell the difference between heartburn and a heart attack?
Oh, man, that is a great question. And I've had patients and friends that have thought they've had heartburn. First of all, heartburn is usually something that happens after a meal and is very acidic-like, all right? It's almost sharp. A heart attack, usually it's a pressure. If you feel that somebody's squeezing your chest, that's usually a heart attack. And heart attacks usually happen after some exertion. Exercise, walking, where your heart needs the most blood. All right? Whereas heartburn usually happens when you're lying down and still. Listen, if there's any question, always go see your doctor.
Yeah.
Don't diagnose yourself.
Absolutely. Well, hey, for more information on Dr. Rodriguez's book and to buy it, we have the link on our website. And guess what? Everyone in our audience is going home with it.